Good morning, everyone. My name is Ray, and this is Dr. Stephen Hong. Dr. Hong is an emergency room physician at Beth Israel Deaconess Medical Center. 3 years ago, Dr. Hong reached out to our lab at MIT CSAIL and told us how difficult and frustrating it is to manage heart failure. 20% of heart failure patients get readmitted to the hospital within 30 days of discharge. As a leading cause of hospitalization in the US, heart failure hospitalizations cost the US healthcare system $12 billion every year. Despite the money we spend, patients are dying. Half of all heart failure patients die within 4 years of diagnosis. The fundamental challenge is the variability of this disease. A treatment regimen that works for patient John may not work for patient Jane. And when a patient is out of the hospital, the therapy has to be constantly adjusted for their changing and dynamic physiological state. But right now, the data is siloed and the intervention is delayed. What if we can learn from this? From millions of patients' retrospective records, we can predict exacerbations and enable timely interventions. And Apollo empowers caregivers from the hospital to the home. Specifically, it helps caregivers figure out when an intervention is needed and what interventions are needed. Our initial solution integrates data from the electronic health records and imaging systems, identifies patients who are at high risk of getting readmitted to the hospital, and provides actionable insights to providers to help them adjust and titrate medications. In the longer term, we'll integrate data from wearable and implantable devices. We will provide service to medical device manufacturers to help them identify patients who may benefit the most from their products and improve their clinical trials. And eventually, we're going to enable patients to get access to care in a timely fashion. My name is Ray. I finished a PhD in computer science at MIT last summer. My co-founder Claire has a business background in healthcare consulting and finance. Our team has 2 machine learning engineers and a scientific advisory board from University of Colorado Hospital, MGH, Mayo Clinic, MIT, BIDMC, and the VA healthcare system. We are seeing strong traction. Our initial prototype was built on 500,000 patient records from Beth Israel Deaconess Medical Center. We recently signed agreements with the VA National Healthcare System and the University of Colorado Hospital System. This will give us additional 2 million patient records to enhance and test our solutions. We're in an exciting time. In 2008, the adoption rate of electronic health record systems in the US was only 8%. In 2010, right before the Affordable Care Act was signed into law, the adoption rate of EHR was 10%. And in 2015, this rate has grew by 9 times. The last decade has left us this massive treasure trove of digital clinical data and a window of opportunity. Our initial customers will be hospitals, because when a heart failure patient gets readmitted to the hospital within 30 days, that rehospitalization is not reimbursed. Furthermore, Medicare and Medicaid financially penalize hospitals for high readmissions of heart failure by deducting the total reimbursement from CMS by up to 3%. Our long-term target customers will be insurers because we save hospitalization costs for their patients, and will be medical device manufacturers because we help them identify patients who may benefit from their devices, improve their clinical trials, and enhance their data analytic capabilities. We're addressing a big market. Our initial beachhead market that targets hospitalization cost savings will be $3 billion in the United States. As we grow and expand to home monitoring and other adjacent disease applications, we're addressing a total market size of above $60 billion. Very fortunately at MIT, we benefit from various programs, including Sandbox, Dishbande, Delta V. We are also fortunate to get grants from the state government as well as NSF. We're at this stage where additional capital will help us speed up growth. We're raising $2.4 million to support our multi-center retrospective study and prospective piloting with our partners, as well as preparation for FDA pre-sub meeting. If you're interested in learning more, please come talk to us and visit apollo.com. Thank you.